Hello, everyone, and welcome to PedChat. Today, I had a chance to interview pediatricians Lucy Marcil and Micheal Hull. Lucy is a pediatrician out of Boston Medical Center, and Micheal Hull is a professor of pediatrics at the University of Texas. They are pediatricians and entrepreneurs and have recently started a company called Street Cred, a nonprofit that provides tax prep for the underprivileged in hospitals and clinics, specifically targeting families eligible for the Earned Income Tax Credit. They are truly changing people's lives. I hope you find their story inspirational. After the episode, feel free to leave a comment. Let's start a conversation and inspire each other.
You want to go first, and then Micheal, you can answer. What did you want to be when you grew up? So think back to when you were 5 years old.
It's kind of boring. I wanted to be a doctor.
That's a first for PedChat.
My mom was in graduate school getting a master's degree in archaeology and was in a human osteology class. So she would take me to her bone lab and I would look at the human pelvises. She taught me how to tell if it was male or female, if the woman had given birth. You could see the hairline fractures. I was just totally fascinated and thought that would be a lot of fun.
Wow. So you knew. That's very rare, I want to say. I don't know what the statistics are around that, where you were 5 years old and you dreamed of being something and you actually did it. So that's pretty cool. What about you, Micheal?
Well, I'll tell you the truth. My parents like to tell the story of me always looking out the window every Tuesday morning when the trash truck would come by, because I was fascinated with the guy that got a ride on the back of the truck. I thought that was a cool job. So I wanted to be a local trash man, and it didn't pan out as well as it did for Lucy.
Micheal, why did you get into medicine? What steered you in that direction? From garbage man to medicine.
That's right. Well, I think, to be frank, early on it was because I was doing well in school, and I thought, at least in the community where I grew up, what do you do if you like science and you get good grades? You think about going to medical school. But a little more inspiring of an answer would be that when I was a freshman in college, so I grew up in this farm town, very rural in Indiana, mostly all white, mostly all Republican, mostly all Christian home. And so when I was a freshman, I had a chance to go to Ecuador. And it was my first time seeing, I think, what scholars would call extreme poverty. And I was charged with manning the triage desk of this makeshift clinic alongside the nurse, so we could determine which patients needed to see the doctor right away, which patients could wait a little bit longer. And I've told this story a couple of times. Lucy has heard it, but we had this little boy come into our clinic carrying his younger sister, and he had trekked all the way down this mountainside to get to us. And he was probably 11, 12 years old. His little sister was 3 or so, and she was super sick. And he just laid her in my lap when we got there. The doctors rushed in. They took her to the back. They discovered that she had this overwhelming infection of her blood. And they pumped her full of antibiotics and fluids, and they eventually saved that little girl's life. And so it was my first experience seeing how modern medicine could change or save lives in really vulnerable settings. But the interesting part, I think, is that the point that really changed me was the little boy, because this was a kid who reminded me a lot of myself, meaning that he had his kind of own hopes and dreams for the world. And by no fault of his own, he was afforded no other choice than to trek down a mountainside to save his little sister's life. And that contrast between the choices he had in his life and the choices that I had in mine growing up in a community with lots of people who believed in me and supported me kind of broke my heart. And so a lot of the career that I have pursued afterwards, especially being a doctor for poor kids, has come out of that experience initially, and then the ongoing experience with seeing contrasts between the privileges that we have as, frankly, as a white male in the United States compared to a lot of other folks who aren't so fortunate.
That's incredible. Lucy, why pediatrics?
Well, similar to Mike, from a very young age, so I grew up in South Carolina and went to public schools that were half Black and half white. Half the kids were living in the projects, and half of them had parents who worked at the university. And I, from a very young age, felt that difference on a very visceral level. My mom is pretty politically active as well. And so she and I would talk about it a lot too, but I'd come home from school and say, I don't understand why this other girl doesn't get to bring lunch from home, why she doesn't know how to read the same way I do, what's going on. And she was very open with me, even at age 6. And so I really experienced, as Mike was saying, how kids that were just like me didn't have the same opportunities. And it was just total random chance. My mom always told me, you're just lucky. So I felt really strongly that it was important for me to give back. And then along the way, discovered as I got older and wasn't a kid myself anymore that I love children, that they're just fun. You can dance with a kid in an exam room and make jokes with them, and just makes my day better to smile at a baby and, have fun with them rather than always be serious with other adults.
And how did you guys meet? Whoever wants to tell the story, I'm fascinated with how you guys met, because you guys are really good friends, right? And as we'll get into a little later, I've started a company together.
Yeah. Well, I can start. Mike, you can jump in. We were in residency together. So we met probably the first day at the Boston Combined Residency Program, which is a combination of Boston Children's Hospital and Boston Medical Center. And we were both in this special track called the Urban Health and Advocacy track. So we're interested in, social problems affecting health. And for different reasons, both Mike and I were interested, particularly in finances and health. But I think we really became friends at first because we loved dancing. We choreographed a dance together our intern year. And really just kind of saw eye to eye in terms of our worldviews and personalities.
Do you have a video of the dance? Because I'd love to share it in the show notes.
We do. It's on Facebook.
Oh, I'm going to find it. So what pushed you guys out of your comfort zone to become an entrepreneur?
Man, I think for me, and Lucy, feel free to chime in, the deeper that we both get into this field, particularly in service to low-income children, the more we realize how multidisciplinary it is. And we've said this many times before, we as pediatricians can prescribe a medicine to fix an asthma attack, but if that child goes back to public housing and has the same exacerbating factors exposed to them over and again, then they are going to end up back in our office again. And so what we should be doing, I think, as a healthcare industry, is starting to look upstream to those things that actually have bigger impact on health outcomes than even the things we can do in the office. And so that would be things like how we structure budgets and policies, and how we build businesses or enterprises that could address some of those issues like hunger or homelessness or low parental incomes. And so for me, it's a very practical way of trying to improve life trajectories for the kids that I take care of. It's going to require entrepreneurial approaches, innovative approaches to the way that we think about health. And so I can go on more about that and kind of my interest in the business side. I did an MBA as part of my training back in California, but I think it's just because it's practical. That's where the solutions are going to come from, at least in my belief.
The other thing I would add is that so I don't have an MBA, and I honestly never even thought of myself as an entrepreneur until I met Mike and kind of started to see the world through a little bit more of a business lens. But I think what he's saying does really resonate with me, which is that, I saw problems both in medical school and before then, and was always someone who wanted to just fix them. And so to do that, you have to kind of figure out solutions and make it happen. And I think that's something we have in common, where we just want to get stuff done and help kids have better lives.
Amazing. So tell us about Street Cred.
Well, I can tell you that the idea for Street Cred didn't come from Lucy or me. Actually, it came from one of my patients. So Lucy and I had been digging into the evidence behind the kind of impact that particular monies or tax credits have on children, and how well they perform in school, and how well how healthy they are, what kind of jobs they get as adults. And I had asked this mom in my clinic where she had got her taxes done, whether or not she knew she was getting certain tax credits that we know as pediatricians make good impact on children. And to make a long story short, she had been using one of these for-profit tax preparers, paying lots of money every year to do so. And I thought that I was being a good pediatrician, and I referred her to this free tax prep center across town in Boston. And she came back at that time when I referred her, it was for her newborn's visit. She came back a couple weeks later, and she told me these stories of the barriers she had faced trying to get those tax credits. She had taken 2 buses and a train across town with her newborn and toddler, which was a feat in and of itself. She had got there, and because it was government funded, it wasn't open at the time for the hours that she needed. She went back again the next week being a tenacious mom. She didn't have the right paperwork, and she said, forget it, Dr. Mike, I'm going to H&R Block. She paid $400 of her $9,000 a year salary. They shaved the monies off her tax credit. And she came back to me and told me this horrendous story. And then the light bulb or aha moment was that she asked a question, which is the reason why we are sitting in front of you today. And she said, well, hey, I waited for you for like 40 minutes in your waiting room today. It would have been a lot easier if I could just got my taxes done while I was here. And so StreetCred, and I'll let Lucy tell you about our mission and what we've done so far and how we're going forward. But it's essentially an effort to make a one-stop shop for programs that are addressing the financial stressors facing a lot of low-income parents, a lot of moms in particular, that are trying to raise kids in these environments that are really tough. So we're trying to put more money in the pockets of those folks so that they can use those monies to raise healthier kids that are ready to learn. And we've made some progress.
As Mike said, our big picture really is we're doing tax prep, but that we are trying to stabilize families' lives financially, get them out of poverty, help them build wealth. And we're doing that because we know that actually does improve kids' health and their future. So we started with taxes, and we started at Boston Medical Center in 2016. And in that year, we were able to do tax preparation for about 180 families and returned $400,000. And then last year, we expanded to 4 sites around Boston and increased our total monies returned to $1.6 million and served about 750 families in those 2 years. And this year, we're in the process of expanding nationally. We also, excitingly, are experimenting with integrating other financial services into our tax preparation. So we collect all this data from families, right? They tell us their whole lives, what's going on. And we think that we can make use of that and help them enroll in multiple programs simultaneously. So we can get them into job training, we can get them financial coaching, we can get them on food stamps, almost the possibilities are endless, really. So we're trying to figure out right now what's the best bundle of those services we can provide them to help them move forward in their lives. We want them to have a brighter future, and we think this is the way to do it.
Interesting. So if I come into one of the clinics, I'm guessing you have volunteers that are there for certain hours, and I go up to I'm sitting in the waiting room. Is it you just walk over and tell me that this is available if I want it? I don't know. Give me a little bit deeper insight to the logistics of how it works.
Yeah, that's a great question. A lot of people are wondering, how does this logistically work? And part of what makes this model really powerful, actually, is that a lot of the ways families get connected to us is through their doctors. So we feel like integrating it into the medical visit is an important part of the concept. So we have doctors screen and refer patients. Any family who makes less than $54,000 a year is eligible to use this service, and probably if they have kids is going to get the earned income tax credit. So we tell doctors, ask families if they've worked at all this year, and if they have, tell them that they could get their taxes done for free. And usually when I have that conversation with families, I kind of see a light bulb go off in their head, where one minute they're a little confused, and the next time they say oh wait, you'll do this for free, so I can get all my money. And I think it really resonates with them. This is a key need they have, and they're excited and they trust us. So we tell them about it. We give them a sheet of paper that has information on how to use the service. And then they call or email or go online and make an appointment. So it does take some pre-work. You can't necessarily do it all in one visit unless you happen to have all your tax documents with you there at that day. So we try to start telling people about it in the fall. And then they can make an appointment. It can be at the same time as their kid's next appointment, or it can be some other time that's more convenient to them. and they bring in all their tax documents. The site itself is located in the clinic. So like a BMC, for example, it's in the lobby, and they have a certified volunteer tax preparer do their taxes. If they have an appointment, they can go off and do that while the tax prep is done. Otherwise, they sit with the preparer and they learn about the tax process. A lot of them find that very empowering. They don't know what their earned income tax credit is. And so learning about it and learning that you get more money if you work more hours has led to a lot of moms telling us, okay, I'm going to go ask my boss if I can work more hours this year.
And so my question to you is, for the pediatricians out there that have an idea like this, right, and want to do something entrepreneurial, how do you recommend them starting? Lucy, do you want to take that question first?
Sure. Yeah. I mean, I think kind of goes back to my earlier comments about not really even seeing myself as an entrepreneur in the beginning, that I think they shouldn't feel overwhelmed by it, because all you really have to do if you see a problem and you have an idea is start where you are. So, you know, we started at BMC, which was a clinic that I was working in, the hospital we both worked in. And it's often much easier to get a little pilot project off the ground in your own community. And then you have to kind of start somewhere. And once you start and you have some results, you're going to get a lot more interest. People were pretty skeptical, honestly, when we started. And we had a few key supporters, but a lot of people who said, you don't have time for this, it's not going to work, you can't do it. And we just ignored them and did it anyway. But then once people saw that it worked, they started to get excited about it. So I think just being really true to your vision and not getting overwhelmed. You know, if we'd thought about how are you going to start a national organization, that would have seemed impossible. So instead, we just thought, like, how can we help some of our patients in Boston?
What about you, Michael? Any advice?
For me, residency, I mean, for the pediatric residents out there, you know, you're working 80 hours a week seeing patients, which for a guy like me who is a pediatrician by training but an entrepreneur at heart, you know, sometimes that can be really wearing on the things that get you out of bed in the morning. So a lot of people, like Lucy mentioned, were like, there's no way you have time to start this thing in the middle of your training. But for me, it was the exact opposite. It was like, I'm not going to finish training if I don't do something that really gets me out of bed in the morning, that really fires me up. Because when I would sit with patients and I would treat the illnesses of the children, but then hear the stories of them getting ripped off by some sort of for-profit tax industry repair, or their struggle to make their way across town to get to the doctor's appointment, and then childcare, and then the SNAP office. You know, that kind of stuff drove me crazy. And so Street Cred was really an outlet for me to pour all of my heart and passions into something that I deeply cared about. Some people, I've got a really good friend, Lucy's friend too, who is ultra passionate about pediatric cardiology. He eats it up. He could read his pediatric cardiology book every night. I think for Lucy and I, that's U.S. social policy. That's social entrepreneurship. That's building these kinds of programs. And so we had to find what it was that lit that fire in us. And I think everybody, I mean, if you really ask yourself, what's that thing that gets you fired up in the morning, or what's that thing you're reading about on Sunday? If it has something to do with starting a program, then you know you got to do it if you're going to do everything else the right way and full of life in the way that you should.
So what would you tell your 25-year-old self, Michael? If you could go back and tell him one thing, what would it be?
Oh, my goodness. 25, what was I doing then? I think what I've learned more than anything, perhaps, is that, especially through residency, which was really tough, is that I have my own limits. You know, there are certain things that make me feel whole and complete, and that has a lot to do with my faith, with my family, with my girlfriend, with my close friends like Lucy. And there is this risk, especially for people who are interested in social entrepreneurship, who are so very focused on making an impact and making a difference in the world and helping the people who are vulnerable, that you could literally do that with all of your time. And I think as much as I love the work that I do, and as much as I am so grateful to have a job that gives me the opportunity to do the work that I do, what I have realized as I've gotten older, which would be different than my 25-year-old self, is that there's a whole heck of a lot more to life than the work that we do. And I think there is a risk in the entrepreneurial world of saying, if you're not 100% into this, you're not going to make it. And I think there's a possibility of you making it if you're 98% into it and you spend the rest of that time with people that matter. And so I don't think I would have said that when I was 25, and I would have liked to hear that from my older self, knowing that it's going to be okay to spend more time with mom and dad, spend more time with your close friends, to do things that fill you up. And the career will fall into place if you're passionate about the work that you're doing.
Yeah, I think that's great advice and something that we've talked about a lot. What else can I add to that? I think, so when I was 25, I was just starting medical school. I had been in the Peace Corps and came back and found myself in the midst of a very different world. No one in my family is in medicine. I really didn't know what I was getting myself into. And I think both Mike and I we're doctors, but we're a little bit different. We're not necessarily taking the traditional path. And so I think for me, I had a struggle around, like, can I really do these things that I want to do? Am I, do I not fit in well enough? I'm not following the rules and the system the way everyone wants me to. And that was a struggle for me to some extent, and kind of at times felt a little bit like, well, you have to just play by the books and that's how it's going to go. And luckily I was able to reconnect with, feeling passionate about these issues and feeling determined that I was just going to do it anyway. But, I guess I would tell myself, and people at that stage in life, that kind of like Mike was saying before, you have to know what really drives you, and you have to remain true to yourself and do those things, because it doesn't really matter how you're supposed to lead your career. But if you do what you're supposed to do and your heart isn't in it, at the end of the day, you're going to get burnout, and you're going to find yourself 40 or 50 wondering what you've done with your life and why you've led someone else's life. And so I think more than ever now, I'm determined to lead my own life and to do the work that I care about.
Awesome.
Can I say something else, Zach, too?
Yeah.
I think the other thing that Lucy and I have talked about before is how important it is to have patience in this whole process. Because, I think the risk of pediatricians or other folks who want to become entrepreneurs is that they'll just lock themselves up in a room and try to think of something that they could do. And every single thing that Lucy and I have ever done, and I think I can speak for both of us when I say this, has come from this unexpected, life-altering moment with someone in some particular setting that, yes, we made decisions to put us in those settings to be changed in that way, but I could not have predicted that mom would have said, how about we do my taxes in the waiting room? Or when I was a medical student, we had a little girl that was brought in by our kindergarten teacher, bruises because they suspected abuse. We found out that she had cancer. The mom, trying to make ends meet, sent her away to southern United States to live with relatives so that she could try to get some work done. And this was in the midst of this little girl's chemotherapy, and so her immune system was down. She got this overwhelming infection. She passed away before her first grade entrance. And that totally broke my heart. And I would not have known that day when I was walking into clinic that I was going to meet this little girl who would be the impetus for my entire career in domestic child poverty issues. So much of the work that we do results from being present every day, being open to something that you see about the world that is wrong, and then trying to dive in to have some sort of an impact on that problem. So anyway, be patient, which I need to tell myself, which is what I'm saying.
Lucy, do you have a story similar to Michael's that inspired you?
Yeah, several. The one that is probably most related to Street Cred is that, so when I was in the Peace Corps, I worked in HIV in Namibia, a country in Southern Africa, and did a bunch of different things. But I had a friend there who was HIV positive. About 20% of the country was at the time. And she was pretty hopeless and despondent. And so she came to me and she said, I want to try to start a women's savings group. So I said, okay, and helped her do that. So we got together a group of women. These women all put in the little amount of money they had every month. It was a set contribution, and then one woman would get all of the money. So since they couldn't save money on their own, this was a way to do it. The month that she got the money, she was so thrilled. She came to me and she said, Lucy, I'm going to buy a refrigerator. And I thought, this makes no sense. Like, you have HIV, you have no food, you have no housing. Like, is this really a good use of your money? But what I realized later was that this refrigerator gave her incredible social capital. So she was able to, in her urban slum, be someone who had this utility that other people didn't have and they wanted. So she could rent or trade space in it. And eventually she used the social capital to get out of that house and to get more financial independence. And she was able to store healthier food that helped her tolerate her HIV medicine better. And so not only her health improved, but her whole life trajectory changed. And that is something that for me, first of all, was shocking to think that, like, I had a friend who was living in these conditions. And again, that could have been me. But also that this tiny amount of money changed her life. And I would have never come up with a program that would have given her a refrigerator. And so it taught me that people really know what they need, and we have to listen to them. And that the core thing that people need is enough money to take care of their basic needs. They can't deal with their health until they have that. So for me, that's why I felt like, finance, ironically, is at the core of health.
Whenever an entrepreneur is feeling down about him or herself, I'll tell the refrigerator story.
Yeah, I mean, the human spirit is pretty incredible. People, they don't give up.
So what's one book that you'd recommend to the audience?
Well, I would recommend Cutting for Stone, but that might be something that people have said before. So if you need, I can think of a different book.
What is that? Cutting through stone?
Cutting for Stone?
For Stone.
It's by a physician, but it's a novel, and it's this really fascinating story that follows a physician through India, Ethiopia, and New York City. And I won't say too much more about it, but I both found it a really gripping read and very inspiring.
I've got a couple, if you don't mind, that I think at least more recently have changed the way that I look at the world a bit. The first is a book called Just Mercy by an attorney named Brian Stevenson.
Yes.
Who is essentially, he represents youths who are on death row. And he started this incredible organization in the South. He has a wonderful TED Talk, which folks should check out. Probably one of the most inspiring, well-spoken folks I've ever heard speak, which I listen to a lot of speeches, so that's hopefully saying something. It's a really inspiring story about race in this country, what it does to folks, how certain populations are up against disparities and injustices in his work that is pushing through. The other, which I think resonated a lot with me just because of where I grew up, is a book called Hillbilly Elegy, which is a big name at this point. It's a New York Times bestseller, written by a guy named J.D. Vance. It talks about essentially a culture in crisis, which is middle America. And so it talks about white poverty, which is something that is not always as talked about, but as we saw in the most recent election, can have a big influence on the outcomes of the entire nation. And so both of those were really inspiring and insightful for me, and I'd recommend them highly as a next read.
If you were to change one thing about healthcare that isn't related to StreetCred and what you guys are doing to StreetCred, what would it be?
I mean, I think this might be trite, but I would say that I would ensure every child, as well as every adult, had access to healthcare.
Yeah, I think I was going to say something very similar. One of my jobs here in Austin in particular, which is a city that's rapidly gentrifying, is that we're running a mobile unit, which is offering wraparound services. So we have medical teams there, but we also have an attorney on board who can offer legal help with immigration issues or housing issues or juvenile justice issues. We've got hopefully a StreetCred personnel on there down the line that can offer financial assistance. We've got a food bank or a food pantry that's mobile. And this all comes out of this idea that healthcare, at least in the past, at least here in Austin, you have these brick and mortar places that were built 30 years ago, intending to be around the people that they were going to serve. And now those places are next to me because the areas are rapidly gentrifying and the property taxes have increased. And so low-income populations are getting pushed farther and farther and farther away from all of the types of support, including health, but other types of services that we know influence health. farther and farther away from those sources. So we're trying to take services to them rather than just building new infrastructure in those places. But I don't think it's sustainable either. And so I think there's some real thought that needs to be given to how do we help families who are most at risk, who are often costing health systems and governments lots of money. How do we get them better, easier, cheaper access to the resources they need to stay out of the hospital, to stay and get healthy, to prevent some of the illnesses that we see that are burdening a lot of health systems today.
Very insightful. I didn't think about the regentrification of an area and that brick and mortars are built around that. When you push people out, they're not close to those healthcare centers anymore.
I think transportation, I think that's a real key to the health of general communities, especially cities that are growing quickly. And if you talk about places in rural America, like mentioned in Hillbilly Elegy or where I grew up, transportation is a huge issue. And so I think there's going to be some sort of disruptive, Uber-esque type of means of getting folks to healthcare or to other types of resources that's going to come about that we just haven't seen yet. So excited to see what that future holds.
Yeah, I think healthcare just needs more Lucy and Micheal duos, innovating and being entrepreneurs, trying to solve problems. Awesome, guys. Well, thank you so much for coming on and being a part of PedChat. Tell people how they can get in touch with you and what kind of help you need over the next 6 to 12 months.
Well, my email address is lucy.marcil, M as in Mary, ARCIL, @bmc.org. And Mike, I don't know, do you want to say yours?
No, I'm just kidding. Yeah, mine is Micheal. That's an AEL, and then .hole, HOLE, like a hole in the ground. And that's a long one at austin.utexas.edu. And I think, for us, we're always looking not just for Street Cred partners, folks that could be the leaders at their various institutions for starting sites for us. But I think both Lucy and I, as social entrepreneurs and people who care about this work, we're certainly easily inspired by folks who are doing similar types of work. And we think there's a lot of overlap because poverty and some of these struggles are so multidisciplinary that it's going to take a village, if you will, a movement, certainly, if we're going to do anything about some of these problems. So please don't hesitate to get in touch with us.